So it works. Hi, Dr. Rob Davidson, who's the emergency room physician in the Grand Rapids area. Appreciate it. Just your reaction to that video. Any of that surprising?
No, it's not surprising at all. We've been talking about wearing masks for at least several months, and I know the initial recommendations were that they weren't necessary, but, you know, science evolves. We learn things. I've been a doctor for 22 years, and we've learned things in my career that are completely different from what I used to do. So it's not surprising at all that masks do work, but it's also not surprising that the science now is, you know, catching up, and the public needs to catch up with the science.
Hey, doctor, let's talk about the effects of all of this compounding on each other. Texas Medical Center in Houston hit 100% ICU bed capacity this week. How concerned are you not only about the hospitalization rate in Texas and other states, but also about where you go from there once you hit that 100% rate?
Yeah, it is terrifying as a physician to consider that my hospital could hit 100% capacity. And then, you know, we all have surge capacity using operating rooms as ICU space, using outpatient centers as inpatient space to free up inpatient beds for more intensive care type patients. And it's just practicing outside the norms. And we know when that happens, that the care can't possibly be what it is when we are practicing within the norms. So I think this is absolutely terrifying, and Texas needs to put on the brakes and go in reverse, and anywhere else that is approaching that number needs to consider doing that.
Well, you mentioned Texas because it is putting on the brakes and kind of going in reverse a little bit. Many of these states are pausing their reopening plans, in fact, and others are putting restrictions back in place. Will that help stop the spread, or is it too late at this point?
Well, my concern is that even a place like Texas that puts on the brakes, they are already so completely or near completely open that I'm not sure what that can possibly do. And really, it becomes about communication and about messaging and public health. It's a concern from the Coronavirus Task Force briefing from just a few days ago. We seem to see a disconnect between public health advice and politicians' advice. And Governor Abbott, fortunately, is now allowing municipalities to mandate mask wearing, something that should have been allowed, you know, months ago. So you know, we can be hopeful. If we can get people to wear masks, then I think we can decrease that spread.
Yeah, we're starting to see more numbers for the case of that, and we want to warn viewers out there that there are also some fraudulent documents where people say that they have, you know, the ability to not wear a mask, and they have medical excuses and that sort of thing. So that is also floating out there.
And, Doctor, I'm really curious about this because Florida is deciding to close the bars and Texas is deciding to close the bars again. Why particular bars as opposed to, say, the gym or restaurants? And why are those out? Doesn't alcohol kill everything?
You know, honestly, alcohol may make people feel more invincible and make them do things that are more risky. We see that in many cases. I think restaurants, bars, and gyms are all ridiculous in places with positivity rates of tests of 15% and cases going up and ICU beds filling up. So, I think if they start with bars, that's great. I think they need to consider any indoor space where we can't maintain social distancing and we can't mandate mask wearing is extremely high risk. In Michigan, in East Lansing, we had one bar that's now resulted in 87 cases across the state.
Wow.
And, you know, that's just raising the red flag everywhere.
Dr. Rob Davidson, thank you so much for weighing in with us this morning.